in a clinical scenario, they might give you a different concept-based question on this. So they might give you a scenario where you are doing a nephrectomy. Okay, you are doing a nephrectomy and you got a you by accidentally there has been injury to the renal renal vein or renal artery, whatever. They will ask you what is the per minute blood loss. What is the per minute blood loss, or what is the per second blood loss which will happen. So you need to use this concept. So you should know the what is the renal blood flow for to solve this. So per minute there will be 650 ml of blood loss. So if they ask you per second, then you have to almost divide it by 60, and this is going to become around 10 ml or 10 to 15 ml per second. Okay, ml per second. So this kind of questions you can expect. That's a clinical application of this knowledge of renal blood flow. Now, what are the factors which are important in the auto-regulation of this blood flow? The concept is auto-regulation. Regarding auto-regulation of blood flow, this tubuloglomerular feedback is very important. One more mechanism you will read in Oxford is the myogenic mechanism, where there is relaxation and dilatation of the smooth muscles of the vessels. That is the this is the afferent and the efferent arterioles. That is the myogenic mechanism. There is nothing much to understand in that, but what is to understand is the tubuloglomerular feedback. We need to understand this really thoroughly. Now, this is a very simple diagram, okay? This is the afferent arteriole. This is the efferent arteriole. So this is going through the glomerulus. This is the PCT. We can see this is the DCT, distal convoluted tubule. Now you can see the distal convoluted tubule comes in very close relation to the afferent arterioles. When there is a so you have to know this, the distal convoluted tubule comes in a very close relation to the afferent arterioles. Okay. Now, if you magnify this, part, this is the distal tubules, which is draining the urine, and this is the afferent arterioles, which comes in very close relation to the distal tubules. Now, this area where the distal tubules comes in close relation to the afferent arterioles is known as juxtaglomerular apparatus. Okay, juxtaglomerular apparatus. Now, why you have to know this? Juxtaglomerular apparatus is formed by two important cells. One is the juxtaglomerular cells. Second is the macula densa. Okay. Now, whatever I'm telling you, everything has been asked previously. You might think that these are too much of physiological things, anatomical things, but they are very fond of asking this. Okay. Juxtaglomerular cells and macula densa. How to remember which cells are present where? So, macula densa, D for distal tubule. Okay, so certain cells of the distant tubule, they get modified to form a macula densa. Okay, you can see these are the macula densa cells. In the cells of the distal tubules condense to form the macula densa. Okay, D for distal tubule, D for densa. Juxtaglomerular apparatus contains two components. One is the JG cells, other is the macula densa. Where is the JG cells? How do you remember? Remember just juxtaglomerular apparatus, A for apparatus, A for afferent arterioles. A for apparatus, A for afferent arterioles. Okay, so you can see here the afferent arteriole cells, they get modified to form the juxtaglomerular cells. So I'm spending some time here because it's important, it's confusing, and we will take question on this and you will understand these are confusing topics. What is the importance of this whole tubuloglomerular feedback? Now, how does it work? Suppose there is a decrease in the blood pressure. Okay, if there is a decrease in the blood pressure, what will happen? These juxtaglomerular cells, which is present in definitely the afferent arterioles, the juxtaglomerular cells are going to release renin. Okay, so what the renin is not released from macula densa. Renin is not released from any other cell. It is released from juxtaglomerular cells. And what is the location of that cell? It is present in the afferent arterioles. So the renin is going to, now we know the mechanism of renin. It's very simple. It converts angiotensinogen, which is produced from the liver, to angiotensin 1. Angiotensin 1 will convert into angiotensin 2 in the lungs, okay, which will release ACE. Okay, and this angiotensin 2 has multiple actions. It will act on the kidneys to cause, so where does it act on the kidney? it will act on the kidney to cause sodium and water reabsorption, and also it will also act on the kidneys to cause efferent arterial vasoconstriction. Okay, it mainly causes efferent arterial vasoconstriction so that the GFR can increase and the urine can increase. And also it's a vasoconstrictor, so the blood pressure can also increase. Also, it stimulates the release of aldosterone, which further helps in sodium and water retention from the principal cells, P cells. From the P cells of the distal tubules, it acts on the P cells of the distal tubules to cause sodium reabsorption. Along with sodium, water will come and the blood pressure will rise. So that's the mechanism how renin is released in response to low blood pressure. How the low blood pressure is sensed? The low blood pressure is sensed when there is low blood flow in the afferent arterioles, because the JG cells in the afferent arteriole, they will realize the blood flow is less, so they will produce more renin. Okay, they will increase the blood pressure now. Now what happens? What is the role of macula densa then? The macula densa, the macula densa is present in the tubules. Sorry, the macula densa is present in the tubules, and the purpose of the macula densa is to sense the sodium in the urine. Okay, so when there is low blood pressure, there is low filtration of the GFR, there is low GFR, and there is low sodium in the urine, that is sensed by the macula densa. So again, this low sodium, which is sensed by the macula densa, is going to stimulate release of renin, and the whole thing will lead to again sodium and water reabsorption. So the main thing, they together work as a unit, but the function is different. Renin is supposed to be released by the JG cells. Macula densa is supposed to sense the sodium in the urine, and JG cells are supposed to sense the blood flow and the blood pressure. Okay, so this is the function you should know. Otherwise, MCQs will you will be confused in the MCQ. The statements will be very confusing. Okay, this is taken from Oxford. This is just to reinforce the same thing. You should know renin is released from the JG cells. There should be no confusion. Where is the JG cells present? Afferent arterioles. Now, what is the stimulus for this? Reduced perfusion, that is low blood pressure is the stimulus. Again, reduced sodium delivery to the macula densa. So all these are very straightforward things, but you should know the concept. Okay, what is the action? It will cause the vasoconstriction of efferent arterioles mainly, so that the if the efferent is obstructed, so the GFR will increase, sodium will increase. Okay, so all this thing stimulates aldosterone, stimulates ADH, so that more water enters the blood. So this is the basic principle of the RAAS system. Tubuloglomerular feedback. What is the function of JG cells? What is the function of macula densa? And so anybody would like to take this? We have not yet discussed.